Today we are looking at the heart blocks and we are looking at the significant ECG findings. So as we begin with some questions, the first question is, in terms of the second degree heart block, what are the significant ECG findings? So in this video we'll find these answers and learn about all the heart blocks and their ECG findings. So to start with, firstly we are looking at the first degree heart block. So it is a first degree heart block. So in terms of the first degree heart block, the main characteristic is that there is a prolonged PR interval. There is a prolonged PR interval. This is very important. And what about the second? So we need to know that second heart block is divided into two. That is, it can be divided into the Mobitz. It is divided into the Mobitz type 1. Next, it is also divided into Mobitz type 2. So we look at it in detail. So Mobitz type 1 is also known as the Wenke back. So now let us just recap what we did. We saw the first heart block. The first degree heart block has a prolonged PR interval. And then we saw the second degree heart block is divided into two categories. That is the Mobitz type 1. And then we also have the Mobitz type 2. So the Mobitz type 1 is aka the Wenke back. So now we'll be dealing with the type 2 in detail. So in type 2, we saw the Mobitz type 2. So in terms of the Mobitz, before that we look at Mobitz type 1. Is also known as the Wenke back. The Wenke back. So in terms of the Wenke back, there is the ECG finding is that the PR interval, it lengthens. The PR interval, it lengthens until 1 P wave. So it lengthens until 1 P wave isn't followed by 1 P wave isn't followed by a QRS complex. It isn't followed by a QRS complex. This is very important to note. And then we look at the second degree. The second degree. So the second degree is known as the Mobitz type 2. The Mobitz type 2. So here the PR interval, it remains constant. The PR, it remains constant and in successive cycles. So just to recap what we did so far, we saw the Mobitz type 1. It is also known as the Wenke back type. Here the PR interval, it lengthens. So the PR interval, it lengthens until 1 P wave is not followed by the QRS complex. Then we had a look at the second degree, that is a Mobitz type 2, and here the PR interval, it remains constant in the successive cycles. Now we'll be looking at further points regarding the Mobitz type 2. So in terms of the Mobitz type 2, there is the P wave. The P wave is not followed by the QRS complex. Is not followed by the QRS complex. This is in every beats. So then we have the type 3, the third degree. So the third degree is nothing but it is known as a complete heart block. So in terms of complete heart block, there is no relation. So there is a no relation, and this is between the P wave and the QRS complex, between the P wave and the QRS complex. So just to recap, we saw the Mobitz type 2. So we already saw the PR interval, it remains constant. So it remains constant in terms of the successive cycles. So this was one point we saw earlier. And then the P wave is not followed by the QRS complex every beat. So every few beats it is not followed by the QRS complex. Next we saw the third degree. It is known as a complete heart block. So here there is no relation between the P wave and the QRS complex. So now we'll be looking at answering our question. So the first question we asked about the second degree heart block. The second degree. So second degree heart block, we specifically asked the Mobitz type 2. So in terms of the second degree heart block, Mobitz type 2, we are going to look at the ECG findings. So the ECG findings, what we saw is that the PR interval, the PR interval is nothing but it is constant. The PR interval remains constant in successive cycles. Remains constant in successive cycles. And the P wave is not followed by the QRS complex. And the P wave, if you see the P wave, it is not followed. The P wave, if you see, it is not followed by the QRS complex. And this is in every few beats. Now, just to recap what we saw, the question was about the second degree heart block, that is a Mobitz type 2. So here the PR interval, it remains constant in successive cycles. The P wave is not followed by the QRS in every few beats. So this was about the types of heart blocks and their ECG findings. To learn and grow daily, please do subscribe.